Hey everyone, it's me again. So I just came back from the dermatologist, and I've been diagnosed with guttate psoriasis. So this is how you spell it. Um, so yeah, they gave me a little fact sheet about it. So guttate psoriasis is a form of acute psoriasis described as a shower of small pink, red, scaly raindrops have fallen all over the body. So it looks like this. Um, so who gets guttate psoriasis? Guttate psoriasis tends to affect children and young adults. It is the second most common form of psoriasis in children after chronic plaque psoriasis. Both sexes and all races can develop guttate psoriasis. It is often the first presentation of psoriasis for an individual, but can also be seen in those with no chronic psoriasis. So, what causes guttate psoriasis? So, this is what it says, so I'll read it to you. Guttate psoriasis typically develops 1 to 2 weeks after a streptococcal infection of the upper respiratory tract, particularly tonsillitis or other sites such as venereal streptococcal dermatitis. Beta hemolytic streptococci can directly stimulate skin-harming T-cell proliferation in the tonsils. Guttate psoriasis has been reported to follow SARS-CoV-2 infection, COVID-19, and other viral infections such as coccidiovirus, viral infection. What are the clinical features of guttate psoriasis? So I'm just going to read this for you, but this is what it looks like. So I kind of have this right now. So it's acute onset over days. So I had it for 2 months. Numerous small patches, true. Pink, scaly, thin patches or plaques of psoriasis, yep. Scale can be subtle in early lesions, widespread lesions predominantly over the trunks and limbs, which is true for me. Lesions on the face, scalp, and ears tend to be faint and short-lived, which is also true. I don't have it on my face, on my scalp or ears, so that is true. Dermoscopy of guttate psoriasis. So this is medical stuff. So uniformly distributed red dot vessels. So this is explaining what it looks like. Diffuse white-grey scale, so dry patches, and bright red, dull red, or pink background, which is true. So these are the diagnostics they use to see in the skin. What are the complications of guttate psoriasis? So I'm just reading this part here. So psychosocial effects of impaired quality of life. Yeah, I mean, my skin's been so bad for 2 months. It's unbelievable. Complications of psoriasis, metabolic syndrome, liver disease. I don't know if I have that, but maybe. Dyspigment in skin of color. Yeah, my skin's very red at the moment. How is guttate psoriasis diagnosed? So I'm going to keep reading for all this. If you're not interested, you can skip. So guttate psoriasis is a clinical diagnosis aided by dermoscopy, which can be confirmed on skin biopsy. Examination investigations include a streptococcal infection. Tests may include source of bacteriology, blood tests, anti-DNAS-B test. What is the differential diagnosis of guttate psoriasis? So it could be pityriasis rosacea, pityriasis lichenoid chronica, or secondary syphilis, if it tests different, but I tested for this. And the treatment for it would be narrowband UVB phototherapy, so UV therapy, emollients like cream, and tonsillectomy for recurrent episodes. I didn't have tonsillitis, so I don't have to do that. What is the outcome for guttate psoriasis? Guttate psoriasis is often a clears within 3 to 4 months without treatment. So patients with proven staphylococcal infection triggered by the Guttate psoriasis have good progress. However, may recur in another episode of staphylococcal infection. Guttate psoriasis may become persistent and evolve into chronic plaque psoriasis. Approximately 2 of cases of Guttate psoriasis develop chronic plaque psoriasis. An even higher rate of chronic psoriasis is seen in patients with Guttate lesions persisting for 12 months or more. So I'm hoping the UV treatment helped me avoid that. You never know. It could get really bad, so it might last more than 12 months, hopefully not. But I already have it for 2 months. It usually leaves 3 or 4 months by itself, but if you want to be faster, you can do UV treatment and put creams on it, steroid creams and stuff. So I'll be starting UV treatment soon. So it'll be over 6 weeks, so 3 sessions for 6 weeks, and hopefully it will get much better from there. But yeah, I mean, at least now I know what I have, which is good, and I'm very happy that now I know, what I have. Makes me feel a bit better. So that's the update I got for the dermatologist. Yeah, I'll just have a little screenshot of the waiting room I was in for dermatology at the hospital. After this, yeah, it was pretty good. Not a lot of wait time, and I was pretty happy with it. So, yeah, so that's the update. If I have anything else to talk about, I will make another video. But that's all for today. So, thank you for watching, and yeah, have a good day. Thank you.